a baby is born on a table as a result of a botched abortion, what would Planned Parenthood want to have happen to that child that's struggling for life? You're recognized.
Thank you, Mr. Chairman. Well, we believe that any decision that's made should be left up to the woman, her family, and the physician.
Thank you, Mr. Chairman. I think that at that point, the patient would be the child struggling on a table. Wouldn't you agree?
You're recognized.
That's a very good question. I really don't know how to answer that.
What objection could you possibly have to obligate a doctor to transport a child born alive to a hospital where it seems to me they would be most likely to be able to survive?
And I'm just speaking out here. What about the situations where it's in a rural healthcare setting? The hospital is 45 minutes, an hour away. That's the closest trauma center, emergency room. There's just some logistical issues involved that we've got some concerns about.
On March 25th, 2022, a pro-life group received a box containing bodies of 115 children from a worker that was taking it from Washington Surgery Center to be incinerated at a renewable waste facility. Inside the box, along with 110 early-term babies, were 5 full-term babies. I encourage all of you to look at these photos because some of these babies were born alive. The 5 babies are Christopher, a full-term baby boy whose body was almost fully intact; Harriet, a baby who was born with one eye open; Phoenix, a baby that was born in caul, meaning an amniotic sac. Some of my colleagues on this committee say that they care about the safety of children, yet they have failed to turn a blind eye to this awful situation because it does not fit their narrative. And I encourage all of you again to continue, because I see people not looking at these photos, to look at these photos, because this is horrific, and this is known as late-term abortion.
And so listen to her story. 2 years ago, 28-year-old Amber Nicole Thurman, a medical assistant and a single mother to a 6-year-old boy, found out she was pregnant. Amber had just secured her own apartment and was thinking about going to nursing school. She made the decision to terminate her pregnancy. A strict abortion ban had recently taken place in her home state of Georgia, which caused Amber to travel to North Carolina for the procedure. Traffic made her miss the appointment, so the clinic gave her medication, what are known as abortion pills. Once back home, Amber experienced profuse bleeding, vomiting, severe pain. She eventually passed out. Her boyfriend called for an ambulance. At the Georgia hospital, Amber's condition deteriorated quickly. In a rare occurrence, it was discovered her body had not expelled all the fetal tissue and an infection was spreading. Official Georgia State medical expert analysis of her case says Amber should have received a life-saving D&C, but doctors waited 20 hours before deciding to take her to surgery. Amber's blood pressure had taken a dive. Her organs had started failing. In the operating room, her heart stopped. On the way to surgery, Amber's last words to her mother were, "Promise me you'll take care of my son."
It says that a doctor who presides over an abortion where the baby survives, the doctor is under no obligation to provide life-saving care to a baby who survives a botched late-term abortion. That is, I think, whether you're pro-choice or pro-abortion, that is fundamentally barbaric. And that's why I use that word, Nora, is because some of what we've seen, do you want to force Catholic hospitals to perform abortions against their will? Because Kamala Harris has supported suing Catholic nuns to violate their freedom of conscience. We can be a big and diverse country where we respect people's freedom of conscience and make the country more pro-baby and pro-family. But please.
Yes, Governor, please respond.
Look, this is one where there's always something there. This is a very simple proposition. These are women's decisions to make about their healthcare decisions, and the physicians who know best when they need to do this. Trying to distort the way a law is written to try and make a point, that's not it at all.
What was I wrong about, Governor? Please tell me, what was I wrong about?
That is not the way the law is written. Look, I've given this advice on a lot of things, that getting involved, getting engaged, that's been misread, and it was fact-checked at the last debate. But the point on this is there's a continuation of these guys to try and tell women or to get involved. I use this line on this, just mind your own business on this. Things worked best when Roe versus Wade was in place. When we do a restoration of Roe, that works best. That doesn't preclude us from increasing funding for children. It doesn't increase us from making sure that once that child's born, like in Minnesota, they get meals. They get early childhood education. They get health care. So the hiding behind we're going to do all these other things when you're not proposing them in your budget. Kamala Harris is proposing them. She's proposing all those things to make life easier for families.
I asked a specific question, Governor. You gave me a slogan as a response.
It's not the case. It's not true. That's not what the law says. So they fact-checked it with President Trump.
I want to clarify what the law is there in Minnesota. Abortion Finder, a website that helps women find access, says abortion is legal throughout pregnancy in Minnesota. There is no ban or limit on abortion in Minnesota based on how far along in a pregnancy you are. You signed the bill that makes it legal through all 9 months. Is that a position you think Democrats should advocate for nationally?
Look, the vice president and I have been clear. The restoration of Roe versus Wade is what we're asking for.
But that
this
law
is a
goes
woman's
far beyond
right
Roe v. Wade.
to make her own choice. The law is very clear. It does not change that. That was been debunked on every occasion. But
wait,
look, this is a.
But let's agree. What you signed is there's not a single limit through 9 months of pregnancy. Roe had a trimester framework that did have limits through the pregnancy. The Minnesota law does not have that.
This puts the decision with the woman and her health care providers. The situation we have is when you don't have the ability of health care providers to provide that, that's where you end up with a situation like Amanda Zaworski in Texas, where they are afraid to do what's necessary. This doesn't change anything. It puts the decision back on to the woman, to the physicians, and we know that this is simply something to be brought up to be very clear. Donald Trump's asking for a nationwide abortion ban.
Wait, he
and
has
again,
said that
we don't see this
he has
as a
said
winning
repeatedly
campaign.
that he will not sign a national abortion ban. Are you calling that just, it's a flat out lie?
Yes, of course. And Senator Vance has in the past said so too. Now look, they may see this as an election issue. We see it as a right of women to make their own bodily decisions. And that's what the states like my state have the ability to put that in. States like Georgia force women to cross the border, and then we have a death of Amber Thurman. So let's be very clear. Trying to cut hairs on an issue on this is not where the American public's at. They want the restoration of Roe versus Wade. Vice President Harris said she would sign it. That's what we'll do when we're elected.
But to be clear, the Minnesota law is far beyond Roe v. Wade. And about the Amber Thurman case in Georgia, her family has, and it's tragic, she is a young mother who left behind a young son. But what her family has said is it was a complication from an abortion pill that she received, and she didn't get proper care when she went to a Georgia hospital, which had multiple opportunities to intervene there. Her own attorney, the family's attorney, says it wasn't the Georgia law, it was the hospitals. What he claims is malpractice, not treating her when she clearly showed up in distress and still had the byproducts of her pregnancy because of that rare complication from the abortion pill. So just to be clear on the Georgia law and how her family and her attorney sees it.
Human cause. We are always the problem. The human person is always live baby being delivered after an abortion that was crying in the bucket that I caught it in.
How did you try to kill it?
I covered it with a towel so it wouldn't cry, so the mother would not hear it cry. However, being a good doctor, it was moving. It was moving.
Was the mother unconscious?
No, the mother was there. Caught it in a bucket. It was squeaking and making noise. It was 23 weeks. It had to be close to what I thought was a pound. Reached in around my towel, trying to suffocate this child. I picked it up by its head and it felt heavy. So I put it on the scales, and that's when it showed 505 grams.
So you didn't just, forgive me, you didn't just let it die. You tried actively to suffocate it at that point, which is no different to killing it within the womb, of course. So I suppose it shouldn't shock me, but it does.
No, this is the whole idea. When they say, when the world says, when a live product of an abortion, they're talking
mother effers.
They are truly MFers, buddy. The whole system is rigged to abort the pregnancy, to decrease fertility. Climate change, too many people, human cause.
So give them credit for solicitude. Look, the policies, maybe not.
I just had this thing in Minnesota. There were 8 deaths among infants who survived abortion attempts during Tim Walz's tenure as governor. It happened. They don't want to talk about the fact that it happened, But there were children.
What's the source of what I'm saying?
First of all, let me ask you a question. Since you've deeply researched this, what were the condition of these babies when they were born?
Why can't
what was the participation of the family?
They tried to abort the babies, and they survived the abortion, and then they died.
And you think that families casually toss them aside?
No, I think.
Tell me what their condition was, Scott. Could they have survived? And was it a case of families not wanting children to suffer who were, when they were told that they are doomed?
Yeah.
Twisting the head off the neck, kind of with his own bare hands.
And you saw that happen?
Yes, sir. Mm-hmm.
So he would twist the head off.
Sometimes he would go through the stomach as well.
Sometimes he would do what?
He would like force it through the stomach.
The instrument, is it Beers?
Like twist it.
Yeah.
And you saw that?
Anything that he could get to the fastest, like she said, the umbilical. He was probably perforating the umbilical cord. I normally saw either the snipping of the spine or the introduction of the instrument in the soft spot of the fetus, normally, or twisting of the neck.
I remember he would put like his finger.
Yeah, or his finger. He'd take his finger and then
through the throat.
Yeah. And it was a botched abortion. The fetus was still alive. He thought it was dead. And the fetus opened his eyes and actually grabbed his finger. Was able to grab his finger.
No hospital, no one will take a baby at 9 months for an abortion.
You want to? Interesting. Just back up. Is it a baby, Ruby? When does it become a baby? Suddenly now it's a baby at 9 months. That's actually factually inaccurate. There are late-term abortionists. Google Dr. Wern, who was featured recently in The Atlantic as the abortion absolutist, and actually talked about committing abortions into the 9th month of pregnancy. So while it is rare, and there's not a lot of abortionists who will kill babies in the 9th month of pregnancy, to say no one is just factually inaccurate. And by the way, if no one would do it, then why are Democrats against passing any law that would restrict late-term abortions? Why can't Democrats name one abortion they don't like and say, we're against this? Why can't they do that?
What I have in my hand here is a Tic Tac. At 6 weeks, a human fetus is about half the size of this Tic Tac, 4 millimeters high. 4 millimeters. It does not have a face, so there's no looking at a face in an ultrasound. And there is no heart, there is no lungs, there is no brain. It doesn't have toes. It looks more like a tadpole. What you detect with the ultrasound machine is the electrical activity of the cells that will become the sinoatrial node that's pumping each of our hearts right now, hopefully, unless you all have a pacemaker. But that little clump of cells is actually detected by the ultrasound machine, and then it creates the sound. Just like our veins and arteries don't go whoosh, whoosh, that's created by the machine.
Blind abortion. So picture yourself introducing this and grabbing anything you can blindly and pull, and I do mean hard, and out pops a leg about that big, which you put down on the table next to you. Reach in again, pull out an arm about the same length, which you put down on the table next to you. And use this instrument again and again to tear out the spine, the intestines, the heart and lungs. Head in the baby that size is about the size of a large plum. Can't see it, but you've a pretty good idea you've got it if you've got your instrument around something and your fingers are spread about as far as they go. You know you did it right if you crush down on the instrument and white material runs out of the cervix. That was the baby's brains. Then you could pull out skull pieces. And you have a day like I had a lot of times, sometimes the little face comes back and stares back at you.
The last abortion that I had, I actually saw the baby come out. This one was the medical abortion. We go to the Planned Parenthood. A guy doctor comes in. He's like, here's the pill. Take the pill. And I'm so scared. So I'm looking at him. He's like, come on. And the doctor's like, take the pill. And I'm looking at him. He's like, what are you waiting for? The doctor's like, the pill's right here. And I'm just like, so much pressure, gave in, put this dumb pill in my mouth. They give me the 4 pills to take home. I sit down on the couch. All of a sudden, I feel like this pain. And I go to the bathroom, and I literally delivered a baby. The baby was like this big. I saw the little tiny limbs, little arm, little everything. And the baby's heart was still beating. And it starts to go slower and slower and slower until the baby passes away. And after that precious life was lost, I almost lost my own life because that abortion didn't go the way Planned Parenthood wanted it to be. They make you sign a waiver that if you happen to die, they are not held liable terrible. I remember calling them and I'm like, I am bleeding uncontrollably. It's been months already. And they're like, it's fine. You're going to be bleeding. You're going to be bleeding. I'm like, something is wrong. The bed soaked in blood. And I started getting a fever and I go to the hospital. I had to pee in a cup and my urine was all like purple. And they did an emergency surgery. What happened was when I delivered the baby, the placenta and everything else stayed inside and it was rotting. And my uterus stayed open. So I had an infection. It was going through my bloodstream. The nurse said that had I not come in within those hours in that morning, she's like, you would have died.
President Trump, during that debate, talked about children that are aborted way in the 8th and 9th month, and then some even after, and mentioned that. To which the ABC News moderator, Lindsay Davis, responded, there is no state in the country where it's legal to kill a baby after it's born, and then immediately turned to Vice President Harris.
There is no state in this country where it is legal to kill a baby after it's born.
Where literally she jumped in to be able to debate the president and to try to, quote unquote, correct him. The problem is there was no one to be able to moderate her in that debate. And make the simple statement, there are not only states in America where that can happen, there are states in America where that does happen. In this simple map of the United States, this lists out the states where there are strong protections for a child after birth. Now, this is not an abortion. This is a botched abortion that has occurred. This is a woman went in with the intent of having an abortion, late term. The child was fully delivered. And in medical practice, in many of these states that are listed here, the child is fully delivered during the abortion. And if the child cries, breathes, the practice is to back away and to allow the child to slowly die on the table, because the intent was an abortion. And so everyone just steps back in the facility and watches the child die on the table, however long that takes. Now, before people say that doesn't occur, 8 states have a requirement that in an abortion, if it's botched and the child's actually fully delivered and they're still alive, they have to report it. And in 8 states, only those 8 that actually do that, there were 277 cases of that. Let me give you an example. This was several years ago. She's now a beautiful young woman now. A young woman named Melissa Oden. She actually didn't know until she was an adult that she was actually the product of a botched abortion. Her mom had been compelled to have an abortion, was a teenager, had been compelled to have an abortion by some family members around her. She didn't want to do it, but she did. It was a late-term abortion. She went in to have the abortion, had the abortion, and after the abortion was over, one of the nurses, looking through the quote-unquote medical waste that was there on the table, saw the young girl crying. She scooped up the infant, took the infant on her own to an emergency room. The emergency room said, there's no way she'll have a full, meaningful life. But they took care of her because she's in the emergency room. And I know Melissa Oden. She's a remarkable lady.
I should have been delivered dead, and instead I was actually born alive. My 19-year-old birth mother, as a college student, had a saline infusion abortion, and that type of procedure was meant to poison me to death. Ultimately, a nurse rushed me off to the neonatal intensive care unit, where medical care ultimately sustained my life. My birth mother had spent over 30 years of her life believing that I had died that day at the hospital. She was not told that I survived. It was kept a secret from her. I was placed for adoption without her ever knowing. She never knew if it was a little boy or a little girl she had delivered in that abortion. She had lived with such incredible regret and heartache. And so we started to communicate by email about 5 years ago, and shared information, built walls of trust and love with one another before we met face to face for the first time about 2 years ago now. I will never forget meeting her and seeing her pain. Her pain haunted me for a very long time after that. But now I get to also experience her joy.
Rightly mentioned, nowhere in America is a woman carrying a pregnancy to term and asking for an abortion. That is not happening. It's insulting to the women of America.
Any woman who becomes pregnant, okay, even if that woman suffers a miscarriage, even if that woman tragically makes the wrong choice and gets rid of the life within her through an abortion, or if the baby comes to full term, cells are exchanged between the mother and the child, living cells, so that after either a miscarriage, tragically, sadly, an abortion, or birth, those cells will remain in your body, ladies, for the rest of your life. You have, and if you didn't know it, you're probably gonna start crying. You have living cells of all your children in your body right now. Scientists discovered that when a woman becomes sick, who has been a mother, they noticed certain clusters of cells from her body going to the ill area in her body. Whatever it was, whatever area, there would be a cluster of cells that would go to this area and would be seeking to make her well, to fight off whether it was a disease, whether it was a sickness, whatever it was. And guess what cells those were? The cells of your children. See, maternity has its blessings.
We're going to call the abortion facility and I'm going to tell them I'm pregnant with a 32-week fetus, as you say. Hi, I just turned 32 weeks pregnant. Am I able to come in for an abortion ASAP?
I wouldn't be able to see you for the week of the 23rd, so that would put you at 34 weeks.
Can I still have an abortion at 34 weeks?
Yes, ma'am. I just have to do an intake form. Do you have about 5 minutes?
Sure, I have 5 minutes. Yeah, I just found out that she could have Down syndrome. I can still have the abortion, right, even though she has Down syndrome?
Yeah, so we just have to do an intake because the doctor...
It doesn't matter. That's late-term abortion, ma'am. That's abortion in the 8th month of pregnancy. That's discriminatory based on someone's genetic code. She just confirmed she would commit an abortion on me with my child who's viable and can live outside the womb.
People calling Karen, how can I help you?
I am looking to have an abortion.
How far along are you?
I'm 34 right now.
An abortion at any stage is actually much safer than delivering a term pregnancy. It's a 4 to 5 day procedure. The needle is inserted through the abdomen and into the fetal heart where lidocaine is injected, and that will completely numb the fetus so there's no pain. And then after that, we inject a medication called digoxin and another medication called KCL into the fetal heart, which will slow and then stop the fetal heartbeat. And then we'll assist you in sort of pushing in the induction and then remove all of the products of conception. We specialize in later trimester care. Our doctor is very well versed in what he's doing and he's very good.
So I'm not like a rare situation. Y'all help women this late in pregnancy all the time?
All the time. Rightly mentioned, nowhere in America is a woman carrying a pregnancy to term and asking for an abortion. That is not happening. It's insulting to the women of America.
No, I'm talking about your bill. How late in the third trimester could a physician perform an abortion if he indicated it would impair the mental health of the woman?
So, I mean, through the third trimester. The third trimester goes all the way up to 40 weeks.
Okay, but to the end of the third trimester?
Yep, I don't think we have a limit in the bill.
Where it's obvious that a woman is about to give birth. She has physical signs that she is about to give a birth. Would that still be a point at which she could request an abortion if she was so certified? She's dilating. I'm asking if your bill allows that.
My bill would allow that, yes.
There is no state in this country where it is legal to kill a baby after it's born.
I rise today in strong support of H.R. 26, the Born Alive Abortion Survivors Protection Act. And this bill does exactly what the title says, which in this town is a novel concept. Today, we are not talking about abortion. We are talking about children. We are talking about children who have been born and are fighting to survive despite an abortion attempt. In some cases, when a woman receives a late-term abortion, the baby can be born alive following the procedure. Federal law currently recognizes these babies as persons, but fails to outline any requirements of care after the infant is born alive. H.R. 26 would rectify this by requiring healthcare practitioners to treat any child born alive after an abortion as they would any infant. and requires that the infant be immediately treated with life-saving care and transported to a hospital. I honestly do not understand what is so controversial about that. This bill establishes criminal penalties for any healthcare practitioner or abortion clinic employee who fails to comply with the requirements established by this bill, because let's face it, no one can deny that a child who survives an abortion attempt, who is outside the womb, breathing and struggling for life despite all attempts to end it, doesn't deserve equal protection under the law. And under our law, murder is illegal.
There is no state in this country where it is legal to kill a baby after it's born.
8 babies in Florida alone, just last year, 8 babies were reported to have been born alive during an abortion attempt. The stories are horrific. One that sticks out in particular, an NBC report in 2006. They told the story of a 23-week-old baby boy that was born alive at an abortion clinic in Hialeah, Florida. When he began breathing and moving, the abortion clinic owner, Belkis Gonzalez, reportedly cut the umbilical cord and zipped him into a biohazard bag, where he then died.
There is no state in this country where it is legal to kill a baby after it's born.
One night, a nursing coworker was taking a little abortion survivor to the soiled utility room to die because she didn't have time to hold him and his parents didn't want anything to do with him. And so when she told me what she was doing, I couldn't let this baby die alone, and so I cradled and rocked him for the 45 minutes that he lived. He was about the size of my hand, and if you saw the State of the Union address with a little Ellie, a 2-year-old who'd been born at 21 weeks, 6 days, the baby I held was just 2 days younger than her. I couldn't tell toward the end of his life if he was still alive unless I held him up against the light to see if I could see his heart beating through his chest wall, because their skin is so thin at that age. And after he was pronounced dead, I folded his little arms across his chest, tied them together with a little string, wrapped him in a shroud, and took him to the morgue where we took all of our dead patients.
Abortion can never on its face be safe, because in order for an abortion to be deemed successful, an individual and unique human being with a beating heart must die. That can never be safe for that individual human life. I want to talk specifically about what a first trimester abortion is and what it looks like from a person who ran a Planned Parenthood abortion facility and was there for 8 years. First trimester abortions are by and large the most common abortion procedure we see in the United States. A transvaginal ultrasound is standard procedure inside of every National Abortion Federation clinic, which includes every Planned Parenthood clinic. That transvaginal ultrasound is done for primarily one reason: to determine how far along the woman is in her pregnancy so that we knew how much to charge her for the abortion. After the ultrasound is performed, the ultrasound machine is rolled away. The doctor comes in, who, by the way, has no conversation with the woman before the abortion. The fact that many people say abortion should be a decision made between a woman and her doctor is laughable. There is never a time where the abortion doctor goes in, sits down with the woman, and goes over risk, alternatives, and benefits to abortion. It does not happen. The doctor starts performing the abortion. He's going to insert into the woman's uterus, into the cervix, metal dilation rods, graduated metal dilation rods. He's going to dilate the cervix enough so that he can insert something called a suction cannula. That cannula looks like a straw. It is graduated. It gets bigger depending on how big the baby is in the womb, so that the head will be able to fit through that suction cannula. He's going to insert that suction probe inside of the woman's uterus. Ultrasound guidance is not used. That is not the standard protocol protocol inside of National Abortion Federation or Planned Parenthood clinics. He's going to take that probe and he's going to blindly poke around inside the woman's uterus until he thinks he has enough blood and tissue in a glass jar. That glass jar is going to go into a lab called the POC lab. POC in the medical community stands for products of conception. The products of conception is, of course, the baby. But you can't say baby inside of the abortion clinic. So we said POC or POC, or if the staff was feeling funny, they would say that it stood for parts of children. After all the parts were accounted for, the POC lab technician would dump everything out into a glass baking dish that sat on top of an X-ray light box, and she would reassemble the parts of the baby. Please understand me, I'm talking about first trimester abortion. Yes, there are parts. Yes, they must be reassembled. The baby is fully formed. Every internal organ is formed by 12 weeks gestation. So yes, there are parts, even earlier than 12 weeks. Once all of the parts are reassembled, that POC tech will take everything, dump it into a red biohazard Ziploc sort of bag, and those bags will go into a freezer in the POC lab that the staff jokingly called the nursery. And once a week, a company, a biohazard medical waste company like Stericycle, will come into the facility and they will pick up all the red bags of babies where they are taken to their facility to be incinerated. That's if the abortion facility decides they don't want to just put them in their industrial size garbage disposal and grind them up and put them into the water waste treatment facilities.
My name is Dr. Anthony Levatino. I'm a practicing obstetrician gynecologist, and I've performed over 1,200 abortions. Today I'm going to describe a third trimester induced abortion, which is performed at 25 weeks to term. At this point, the baby is almost fully developed and viable, meaning he or she could survive outside the womb if the mother were to go into labor prematurely. Because the baby is so large and developed, this procedure takes 3 or 4 days to complete. On day 1, the abortionist uses a large needle to inject a drug called digoxin. Digoxin is generally used to treat heart problems, but a high enough dosage of digoxin will cause fatal cardiac arrest. The abortionist inserts the needle with the digoxin through the woman's abdomen or through her vagina and into the baby, targeting either the head, torso, or heart. The baby will feel it. Babies at this stage feel pain. When the needle pierces the baby's body and the digoxin takes effect, the life of the baby will end. The abortionist then inserts multiple sticks of seaweed called laminaria into the woman's cervix. They will slowly open up the cervix for delivery of a stillborn baby. While the woman waits for the laminaria to dilate her cervix, she carries her dead baby inside of her for 2 to 3 days. On day 2, the abortionist replaces the laminaria and may perform a second ultrasound to ensure the baby is dead. If the child is still alive, he administers another lethal dose of digoxin. The woman then goes back to where she is staying while her cervix continues to dilate. If she goes into labor and is unable to make it to the clinic in time, she will give birth at home or in a hotel. In this case, she may be advised to deliver her baby into a bathroom toilet. The abortionist then comes to remove the baby and clean up. If she can make it to the clinic, she will do so during her severest contractions and deliver her dead son or daughter. If the baby does not come out whole, then the procedure becomes a D&E, a dilation and evacuation, and the abortionist uses clamps and forceps to dismember the baby, piece by piece. Once the placenta and all the body parts have been removed, the abortion is complete. Late-term abortions have a high risk of hemorrhage, lacerations, and uterine perforations, as well as a risk of maternal death. Future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. As I mentioned at the beginning, I'm Dr. Anthony Levatino, and in the early part of my career as an OBGYN, I performed over 1,200 abortions. One day, after completing one of those abortions, I looked at the remains of a preborn child whose life I had ended, and all I could see was someone's son or daughter. I came to realize that killing a baby at any stage of pregnancy for any reason is wrong. I want you to know today, no matter where you're at or what you've done, you can change. Make a decision today to protect the preborn. Thank you for your time.